let's talk about whiplash for a minute. You're all familiar with whiplash, right? Everyone knows it's real. Everyone knows it exists. And what is it? Everyone would say you get hit from the back in a car. Your head goes back, whether you have a headrest or not, and the muscles of the neck get stretched or sprained or strained or whatever, and then you get pain or disability or headaches. And how long can whiplash last? They did a study on this in Canada, and they asked people, how long do you think whiplash would last if you had this scenario? And they said, weeks, months, or years. So there's an expectation that whiplash might occur for years. Well, in Norway, there was a researcher, and at the time, there was about 40,000 people on disability for whiplash in Norway, which is a huge number of people, considering there's only 5 million people in the country. And he went to another country where they treated people differently. Because if you're in Norway and you get in a car accident, you go to the hospital, what do they tell you? What do they tell you to do the next day?
You might have neck pain.
You might have neck pain. You might have whiplash. Go home, rest. Put a heating pack on it, or put some ice on it. Wear a collar, right? So he went to Lithuania, and he studied people in Lithuania after car accidents. In Lithuania, what do they tell you to do after you have a car accident and your neck goes back?
Go back to work.
Exactly. They tell you, go back to work. So, what did he find? He interviewed 200 people in Lithuania who had been in car accidents and 200 people who hadn't been in car accidents. There was no difference between the amount of headache, neck pain, or disability in the people who had been in car accidents versus the people who hadn't been in car accidents. What does that mean? It means whiplash doesn't exist in Lithuania. There's an article in a journal in one of the Canadian medical journals. It says, the title of the article is Cure for Whiplash, 1 ticket to Lithuania, please. Because it doesn't exist there. But it exists here because we believe that it exists. We expect that it will occur. And that's what we find. I have a very good friend, very nice, charming, wonderful, bright lady who was in a rollover car accident, had a lot of bumps and bruises, went to the emergency room, x-rays were negative, nothing was broken. 2 or 3 days later, she started getting neck pain. And the pain got worse and worse and worse. And a year later, she's in tears. And she's been through physical therapy and acupuncture and massage, and no one can help her. And she's wearing the collar, and she's walking around like this, and she's in tears. And one day she was at a party, and someone said, you might want to read one of these books by Dr. Sarno. It's a good friend of mine. She said, what have I got to lose? She picked up one of his books. This was several years ago. She read the book. She started doing some simple exercises. 10 days later, her neck was fine. What did she have? She had fear. She had the fear and the anxiety of having the accident and the expectation that she might get this thing that we call whiplash. And she got it. But she didn't have a serious problem. Nothing was broken. But that pain and that spasm can last for a long time. And the other thing is, it didn't matter when this study, it didn't matter if people had a headrest or not. It didn't matter if the car was totaled or not. It didn't matter if they were wearing seatbelts. It didn't matter what the speed of the accident was. None of those things had any effect on whether people got pain or not. The most important aspect about whether people got pain or not was if there was an expectation that they would or wouldn't have pain. This is an amazing, amazing study. This was done. Doctors and lawyers don't often, get along. Well, this is done in a legal journal. There's a lot of litigation, right, around whiplash. There's a lot of litigation. I just got called the other day about by an attorney who there was a guy who was hit by a postal truck. Well, he's been in pain for a long time now, and he's suing. And so they did this study where they put people in a simulated auditorium. And you know how they have these amazing special effects where in the simulated room it can seem like anything is happening to you. You'll be flipping upside down, or like you're in a roller coaster, right? Well, what they did is they simulated a car accident, like you would get whiplash, right? So they simulated getting hit from behind in a car accident. So the people in the room felt like that's what was happening to them. But their neck didn't move. Okay? Neck did not move. Not an inch, not a centimeter. But they had the sensation of being jarred. So what happened? Well, after the, quote, accident, 18% had neck pain. 18% of people had neck pain right away, even though their neck didn't move. At 3 days, 20% had neck pain. And 4 weeks, 1 month later, 5 had neck pain. That's 10% of the people had neck pain 1 month later, even though there was no real trauma to the neck at all. What's causing this pain? What's causing this pain? TMS. The mind expecting to have pain. And what was fascinating in this study, the people who had pain were the ones who were most stressed or distressed at the time in their lives. So if an accident occurs at a time in our lives when we're stressed, when things are going on in our lives that are stressful, we're much more likely to develop a chronic pain syndrome than if we're not stressed. Okay? Very important.